Been telling you about this longer wait times, a lot more sick people. It's creating a new crisis at many local hospitals. Here to answer questions is Dr. Ali Raja, Deputy Chair of the Department of Emergency Medicine at Mass General, here in the studio with us. Thank you for the visit, Dr. Raja, and
Thanks,
for always being here for us.
Absolutely.
We appreciate you're so generous with your time. So you've been telling us for weeks now, RSV is surging. It's now entering kind of peak flu season. COVID-19 is still out there. Our numbers have been a little down on COVID-19 in Massachusetts, luckily. But how big is the challenge right now in the Mass General ER where you work every day?
It's pretty big, Ben. Right now, the problem is not just that we're seeing more patients, but also that we don't have much staff. And actually, it's not just staff in the ER or in the hospital. It's staff in the nursing homes. It's staff in the rehabs. When we can't send patients to those places, they back up in the hospital, and then they back up in the ER as well.
So talking about those backups, people who maybe don't frequent the ER often may think it's something where you get immediately seen, or at least you don't need to wait too long. But what's the reality right now at Mass General, for example?
That's a great question, Erica, because hopefully people don't end up in the ER more than just a couple of times in their lives, or hopefully none at all. The first thing that happens is you actually see a triage nurse, and that's one of our most experienced nurses. And so if you have a heart attack or a stroke, you get taken right back in and get seen by a team of doctors and nurses. But if you don't have one of those things that needs to be seen right now, you may end up waiting, sometimes 20 or 30 minutes, sometimes a couple of hours.
So we know you're well aware. 2020, March, April 2020 feels like a long time ago, but on some level it also feels like it was yesterday, and a lot of hospitals, including yours, were pushed totally to the limit in the early days of the pandemic and then again in the various surges we had. How does the situation today compare to what we saw in the worst of the pandemic?
Ben, in some ways it's just as bad. I've got to tell you, I just came from a shift. I left an hour and a half ago. And the area of the department that I was working with has about 20, 22 beds. I had 40 patients in that part of the emergency department, so there were almost as many patients outside of rooms in the hallway as there were in rooms. And what that means is that right now, if you go to the hospital in an emergency department somewhere in the state of Massachusetts, you're almost as likely to be in the hallway as you are in a room. But don't worry, the nurses, the doctors, everybody else who's caring for you is going to give you great care no matter where you are.
And I'd imagine that presents additional challenges when you're dealing with respiratory viruses, because you want to try to isolate those people, right?
And if you know in advance, you can isolate them. But if somebody tests positive for COVID incidentally when they've been in a hallway, well, at that point, we try to move them into a room as soon as possible. Fortunately, all across the state, patients still need to wear masks when they come in. So even if they do test positive, they've been wearing a mask the whole time.
Okay, and if it's not a true emergency, I guess the one thing people can do to help is not just show up at the ER unless you really need.
You're absolutely right, Eric.
Urgent care is a great resource.
Yeah, Dr. Ali Raja, thank you again. Wonderful to have you with us.
Thank you. You
thank
too.
you so much.
Thanks for having me.
See you, Dr. Raja.